structures. So this is capsule, right? Renal capsule. On the inside, we can see two tissue types: cortex on the outside, medulla on the arranged in pyramids, right? So this structurally is a medullary pyramid. What's the tissue? It's medullary tissue. The cortex that dips down between the medullary pyramids is called the renal column. Okay, so the renal pyramids, as you go down into here, we have, in this pale region, what's papillary duct. So these areas here are the minor calyces. 11. 12, we're moving down. We have convergence of two minor calyces. Here's a major calyx. Okay. Where it is very wide, 13, right before we enter the ureter, we have the renal pelvis. Okay. So here, 10, here you can see little dots, and so those are the papillary ducts. Okay. And what's on top of the kidney, here's the adrenal gland. The adrenal gland also has a cortex and a medulla. Okay, so we'll learn those in endocrine. In terms of blood supply, we have the renal artery, renal vein. Renal artery, once it splits, becomes segmental artery. We follow the segmental artery up, it becomes interlobar. And then we come up around, this is arcuate, and then we can call this interlobular or cortical radiate. As we come back down, the blood drains with an interlobular vein, then goes to the arcuate vein, and the arcuate vein just drains right into the renal vein. So there's no segmental. Oh, I'm sorry, this is the interlobar vein. Interlobar vein just drains into the renal vein. Okay? So here we have these tiny balls are the renal corpuscles, and so I'm just going to move over here to look at those. So we have renal corpuscles. If we open the renal corpuscle up, we have a Bowman's capsule and then inside a glomerulus. Okay? This is actually really good blood also because you can come up and this is the interlobar artery. This is the arcuate artery. Here is the cortical radiate artery or the interlobular artery. And you can see the artery going in, becoming the glomerulus, right? So we have going in and out. This is the, actually, you could, this is the afferent arteriole, but, and then the efferent arteriole coming out. So then also the blood supply going down with veins, right? So these would be the interlobular vein, arcuate vein, interlobar vein, and then out. This is cortex, medulla. Here are papillary ducts, okay? And here, this wide area, this is our minor calyx. Okay, for the nephron. So we have our renal corpuscle. If you start and go down, follow it, right? This part is the proximal convoluted tubule. We go down, this is the descending limb of the loop of Henle, the ascending limb of the loop of Henle. This is the distal convoluted tubule. Notice how the distal convoluted tubule comes back and hits the renal corpuscle again. Then the distal convoluted tubule will drain into the collecting duct. So the collecting duct has lots of little appendages, I guess, the cut of other nephrons feeding into it. So one collecting duct will come down, it will widen into a papillary duct, and the papillary duct is the end and drains into the minor calyx. Okay, and that's the nephron here. So just be careful because here, you know, just follow the corpuscle because just look, the first part that comes out, this is the proximal convoluted tubule. Okay, it's on the opposite side as this one, right? Here's the proximal convoluted tubule there. Okay, so this one is a blow-up of the entire corpuscle. So we can actually see Bowman's capsule, the parietal layer of Bowman's capsule, simple squamous cells. The visceral layer of Bowman's capsule are podocytes. The podocytes are right on top of the glomerulus, which is the capillary. Here's our afferent arteriole, because I know that because it's cut open to show you those juxtaglomerular cells. And so you can also see these little lines here. Those are the slit membranes, those slit filtration membranes. So here's your afferent arteriole. Here's your efferent arteriole. This is the distal convoluted tubule. The cells sandwiched a little bit tighter than the rest of the cells, 37, these are the macula densa. Okay, so macula densa with these cells here create the juxtaglomerular complex with mesangial cells which are missing. As we go down here, we can see the Bowman's capsule, the filtrate would leave, and this is the proximal convoluted tubule. What's not shown, you can see the cuboid cells, but what's not shown are the microvilli. So they really should have really long microvilli on here, which is not. Okay, so that's this. And then here we basically have this. So actually I'm not going to go over this because this is basically a mimic of those things, same thing. Yeah. And so is this, and this is the same thing. Okay. So we're moving on to, this is too small for me to ask you any interior things, so I'm going to use this for all the detail. This is just kidney, adrenal glands. We have our abdominal aorta, we have our inferior vena cava. You can see the ureters coming out, right, and then the ureters would go into the bladder. So here's our bladder. And we have ureters going in. When we open the bladder, one structure that's very obvious is this white area. So that's the trigone, which is a smooth area to funnel the urine into the urethra. Okay, so this is a male bladder, right? Because we can see on the surface of it, we have the, this is going to be the vas deferens coming from the testicles. Here are the seminal vesicles that create semen. This is the prostate gland that also creates some semen. So these both contribute to the semen. Sperm travel through this guy. You can see how the bladder is situated, right? Here's your pubic symphysis. So it's right behind the pubic symphysis. Okay? And so this guy is pretty simple, just a big structure on the outside. So this is basically your kidneys, right? Your pancreas. Here's our spleen. This is the duodenum. And this is a chunk of the liver. And attached to the liver is the gallbladder. So on the anterior surface here, we're going to look at the pancreas, and we have a really big duct that runs along the midline of the pancreas. So this is the pancreatic duct. The pancreatic duct goes down. The one that's on top is called the accessory pancreatic duct. Okay? The pancreas has a head region that sits in the crook of the duodenum. It has a body and it has a tail. So if we look at the duodenum, we can see these ridges are the plicae circularis, which are the permanent circular folds. We can see the duodenal papilla, okay, which is where the pancreatic duct and the common bile duct come together, and both of those substances, bile and pancreatic juice, are secreted right here. This is the opening for the accessory pancreatic duct. Okay, so that's pretty much it for this area. Number 11, this signifies the change to the jejunum. Okay, so but basically the duodenum is very, this is it. It's just a small C shape that hugs the head of the pancreas. Okay, if we go to the back, this is a good model to show you the different ducts from the gallbladder and the liver. So here is the gallbladder that stores bile. Here is the cystic duct. Okay, here is the liver. There's two little small ducts called the right and left hepatic duct. The right and left hepatic duct come together. This is called the common hepatic duct. The common hepatic duct plus the cystic duct together make the common bile duct. Okay, and that is pretty much all I'll ask for this model. So we have two lobes of the liver. We have the right lobe and left lobe. We have the falciform ligament running between those two lobes, right? So you can see it from the back also. Here's your inferior vena cava. We have the caudate lobe and the quadrate lobe, and then we have the gallbladder here attached. And right here, this three structures, this is called the porta hepatis. Yeah, but the triads are within the lobules. Okay, so the porta hepatis is the common bile. Sorry, what is this one? Hepatic portal vein. And then here's our hepatic artery, and this is our common bile duct. And I'm calling this common bile because if you look carefully, this is our cystic duct. We actually have a right and left hepatic duct. They come together to form the common hepatic duct, and then the cystic plus common hepatic will come out this way. So this is your common bile at the very, very surface. Okay, so that's the nitty-gritty of that. And that's pretty much it for the layers that you can see from the outside. So this is the peritoneum, or you can call it serosa, okay? So it's visceral peritoneum, or it's the serosa. Then you have 3 layers of smooth muscle in the stomach. So they peeled away. This is the deepest one. So this is the oblique layer. And then if you need to look carefully at the way the fibers run for the next 2. So if you see the fibers run and they wrap around the stomach, this is the circular layer. Okay? And then you look again, and then you're going to find fibers that run along the length, and this is your longitudinal layer. Okay? So you have 1, 2, 3 layers. Okay. So other structures are, here's the esophagus coming down into the stomach. The region of the stomach along right around the esophagus is called the cardia. Okay, and I think that there's a number there indicating that this is the cardia. The fundus of the stomach is the part that kind of comes up above, and this area here's the fundus. The rest of the stomach is the body, and then here's the anatomical divide between the body and the pylorus. Okay, so it's kind of the straightaway here. And then you can actually see a narrowing of the muscle of the stomach. So this is your pyloric sphincter. Okay, so right beyond it, then this would be the duodenum. Okay, so you can see nice rugae inside the stomach. And other structures you might want to know are the 2 curvatures, right? So we have the lesser curvature here, and we have the greater curvature here. And the lesser omentum, remember, hangs from the lesser curvature up to the liver, and the greater omentum hangs from the greater curvature down over your intestines. Okay. Another thing is there's no, I was showing you the pyloric sphincters, but there's no widening to show you, oh yeah, there is. No, there's not. That's the pyloric. So here's your esophagus. There's no indication of a lower esophageal sphincter because the lower esophageal sphincter is not a very well-developed sphincter. So, but you should know that there is muscle there that can contract. All right, that's the stuff. For him, I'll use him for respiratory. So for respiratory, we have ridges in the nose, and those are called nasal conchae. So we have a superior, middle, and inferior nasal conchae. As we come back, this whole common area for air and food is called pharynx, right? So if it's right across from the nose, we have the nasopharynx in this area. If it's across from the mouth, we have the oropharynx here. If it's down here, right before we get to esophagus, we have the laryngopharynx because the larynx is right here. The separation between nasal cavity, oral cavity is palate. Hard palate supported by bone. Okay, this is the maxilla. Soft palate not supported by bone. The end of the soft palate is called the uvula. Here's our tongue. Here is the epiglottis. Okay, so the epiglottis, this light blue color is actually cartilage. So the epiglottis is elastic cartilage. This is this structure right up until about here. This is the larynx. And then this little guy there, that indicates your vocal cords. We have a better model when we get there. And then we have, this is your thyroid cartilage. That bump that it creates, this is your, it's called the thyroid prominence, but it's your Adam's apple. And then down here we have the cricoid cartilage. So thyroid cartilage, and this is also cricoid cartilage in the back. I think that's it for this guy. Oh, we have a little hole here. Whoops. That's the opening to the eustachian tube. And then we have, I think I'm going to bring up sinuses again. So we have our frontal sinus, and we have our sphenoid sinus back there. Okay, so that's it for him.
Not right?